So today my topic is going to be, as requested, on ingrown hair. So what is ingrown hair? So an ingrown hair is a strand of hair that grows back into your skin after shaving, tweezing, or even waxing. Ingrown hairs are sometimes called razor bumps, shave bumps, or barber bumps. So to the left of my screen is what a normal hair follicle looks like. And when someone has an ingrown hair, you see the hair is curved back into. So what are the symptoms of ingrown hair? Skin irritation, small bumps with hairs in the middle of your face and neck, pain, discoloration, can be red, brown, or purple, itching. If an ingrown hair becomes infected, you may notice the bumps getting bigger and more painful. Pustules occur when there's pus around the follicles. This infection can lead to scarring. They commonly appear around the face, legs, armpits, and even pubic areas. So this is what it looks like. This is a picture of a man, and this is what the face. So what are the causes of ingrown hair? Ingrown hair occurs when a hair that's been removed starts to grow back, as I stated before, and curves into a skin. A curved hair follicle, which produces tightly curled hair, is believed to encourage the hair to re-enter the skin once the hair is cut and starts to grow back. How are ingrown hair treated? There are several ways to treat ingrown hairs at home, including stop shaving and allow the hair to grow. That's an option, but I don't think most of us are going to do that, right? Use an electric shaver. Hold it just above the surface of your skin, however, when you are using it. Use depilatory products to remove hair without shaving. Depilatory products dissolve the protein structures of your hair. Apply warm compresses to your affected skin for 10 to 15 minutes to open your pores and make it easier for ingrown hairs to be released. If your symptoms don't improve, your healthcare provider may need to prescribe medications and describe inflammation and improve infection to decrease the inflammation, and improve infections. In rare cases, the healthcare provider may use what's called what is a sterile surgical knife with a thin blade, scalpel, to make a small cut in your affected area. They'll squeeze out any pus and use sterile tweezers to remove the ingrown hair. To prevent scarring or infection, don't pick at it, scratch, or pop ingrown hairs. I know a lot of people like to do that, but don't do that. So what medications are used to treat it? Your healthcare provider may prescribe medication that can decrease the inflammation and improve infections from ingrown hairs. This includes antibiotics, ointments, or pills, prescriptions acne medications like retinoids to help remove dead skin, steroid pills or cream help to reduce the inflammation. For more serious cases, your healthcare provider may recommend other hair removal options, including electrolysis. This technique uses a tiny needle and a mild electrical zap to destroy your hair roots one by one. Each hair follicle requires treatment, so it may not be practical to use electrolysis over a large area of your body. Laser hair removal is also another option. In this technique, heat from a laser destroys cells that have a lot of pigment color. This works best on dark hair. What are some of the complications? So this is what it looks like, right? So one of the big things, especially during COVID, people that had this, self-esteem, right? Because when you have the mask on, you wear the mask, it gets soiled, it gets dirty, you put that same mask back on, and that, of course, causes the infection. And so most people, of course, was not comfortable not wearing it, or if they wear it, then they have to worry about how they look, how they feel, and that does a lot for someone's self-esteem as well. So ingrown hair that doesn't clear up can lead to bacterial infection. Patches of skin that are darker than usual, post-inflammatory hyperpigmentation. Raised scars that are darker than surrounding skin, keloids. Pseudofolliculitis barbae, also known as razor bumps, and fine depressed scars or grooves. So, you want to make sure that you're not wearing things that's squeezing onto these bumps. That includes when you do pubic area, razors, or waxing. Be careful of that, because that just irritates it more. So how can I prevent ingrown hair? The best way to prevent ingrown hairs is to use proper hair removal techniques, including before shaving any area of your body, thoroughly wet your skin and hair with warm water. Apply lubricating shaving gel or cream to your skin for a few minutes before shaving to soften the hair. Use a single blade razor if you must. Shave in the direction your hair grows naturally. Rinse the razor blade after every stroke. Change the razor blade or replace the disposable razor frequently to prevent skin irritation and cuts. Don't pull your skin while shaving. Rinse your skin and apply cool, wet cloth for about 5 minutes. Then use a soothing aftershave product or a glycolic acid lotion to help remove dead skin cells. That's to exfoliate. The following hair removal methods also may help prevent ingrown hair. Electric razors or clippers. With the razor, avoid the closest shaving setting. Avoid the closest shaving setting. Hold the razor or clippers slightly away from your skin. Chemical hair remover. The chemicals in hair removal products may irritate your skin, so test a small patch of hair first. And that's with anything that you use on your skin. You want to make sure you test a small patch first, including face creams. A reminder, ingrown hairs are a common skin condition. They may appear anywhere hair grows on your body, but they commonly appear in places where you shave, tweeze, or wax, especially your face, legs, armpits, and pubic area. A good skincare routine helps prevent ingrown hairs from forming, while at-home treatments can help release the hair from underneath your skin and provide relief. Contact your healthcare provider if you notice any signs of infection. You want to gently exfoliating cleanser, such as one that contains alpha or beta hydroxy acids, can help to remove dead skin cells and oil, minimizing the risk of trapping hairs during the hair removal process. You may also want to follow up with a moisturizer that contains salicylic acid or a topical retinoid. These are only if you can tolerate them. Using creams with salicylic acid can help open the pores and follicles, preventing them from clogging, thus preventing ingrown hair. For hairs that are embedded too far into the skin, you can use tweezers to gently release the hair, but just be careful not to pierce the skin or cause damage. If the ingrown hair is deeper, see your dermatologist to get it safely and professionally removed. And if you really struggle with ingrown hairs, you may consider permanent hair removal. For severe cases, laser hair removal is a great option for those who no longer want hair in that area. Some possible daily routine and treatments that I can talk to you about. For a daily exfoliator, some use brown sugar scrub made with coconut, sweet almond, jojoba seed, and castor oils that will leave skin soft and moisturized. An exfoliating cleanser that contains benzoyl peroxide to help keep pores and hair follicles clear, thus preventing ingrown hairs. Topical's high roller ingrown hair tonic with AHA and BHA. A retinoid face cream that delivers the anti-aging benefits of retinol along with the added benefits of helping prevent ingrown hairs. Also ensure it contains lactic acid and AHA to prevent pores and hair follicles from becoming clogged. Witch hazel, one of my favorite to use actually. Willow bark extract and lactic acid. This serum spray soothes bumps and ingrown prone skin and is gentle enough to use on the face, bikini area alike. Boscia, papaya, and pomegranate enzyme exfoliating body cleanser. This cleanser gel uses medelic and lactic acids along with fruit enzymes with papaya and pomegranate to gently remove dead skin cells in the shower. In addition to helping keep ingrown hairs at bay, the acid-powered formula can also help treat hyperpigmentation. I want to give special acknowledgement to the Mayo Clinic, Cleveland Clinic, Cedars-Sinai, and NYU Langone for the information that I provided you today. I hope this was helpful. Please feel free to join me in the Zoom room immediately after service, and I'll be happy to answer any questions for you. Thank you. God bless. Enjoy the rest of the service. And for those of you in Jamaica, enjoy the weather, enjoy the service. God bless, and enjoy some mangoes just for me. God bless you.